everyone, welcome back. Today I'm going to cover a short topic and frequently asked question regarding ear drops, how to administer eye drops and ear drops. So first let's go to eye drops. Now about eye drops, the commonly asked questions and the precautions we need to take, we need to be aware of is, first thing, you instill the eye drop into the conjunctival sac, not directly onto the center of the eye. You instill it into the conjunctival sac because you don't want to injure the eye or also it prevents direct touch infection, always into the conjunctival sac. So this is where you instill the eye drop, not directly onto the center of the eye, the visible part of the eye. Second thing to do is never touch the tip of the eye drops into the eye because it could cause infection. It could again cause injury or infection. So there should be a small distance. You should instill it with a distance. Never touch the tip with the eye. After instilling the drops, you should ask the patient to close the eyes and just move the eyeball, just roll it around. Never rub. Okay, so never rub, just close the eyes and ask a person to just move your eyeballs round, clockwise or anti-clockwise. Another very important thing, after instilling the eye drop, see the eye drop is for the eye, right? You want the maximum effect to be seen inside where, just in your eye, the local effect. You don't want a systemic effect. Certain drugs, certain eye drops such as Timolol, okay, it is a beta blocker. So you don't want the drugs, we want the action of the drug locally. You don't want it to go into systemic circulation. So you have your nasolacrimal duct here, okay, on the medial side of the eye. It's called the inner canthus, this part. So you have to apply gentle pressure. Say I have instilled it on my right eye, I apply gentle pressure on the inner canthus, the nasolacrimal duct, the medial side of the eye, so that the medicine does not enter into the systemic circulation. For example, a beta blocker drug, if it goes into the systemic, it could have side effects of beta blockers like a decrease in the heart rate and so on. Never wipe from out to in. When you wipe from out to in, what happens? Again, your nasolacrimal duct is on the inner canthus side, on the medial side. You wipe from out to inside, you are promoting its spread of infection into the system. Now, say you have to instill 2 eye drops. You don't do it back to back. You instill one eye drop, wait for at least 5 minutes and then only instill the second eye drop. That is, you need to give time for it to be absorbed. So these were the important things about the eye drops. Now moving on to ear drops. Now, if I have to instill on the ear drops, the position should be, if I'm instilling on the left ear, it would be right lateral position. If it is on the right ear, it would be left lateral position. So you could either, if the patient is sitting, you could just ask the patient to tilt the head such that the ear is facing up, or if the patient is lying down, again sideways so that the ear is facing on top. Another important frequently asked question is, how do you straighten the ears? So for an adult, you have to pull the ear upward and outward. For a child, you have to pull the ear down and backward. Adult, upward and outward. Child, downward and backward. Again, stay in that position for at least 2 to 5 minutes. And again, don't allow the tip of the bottle to touch the ears, because again, you don't want the infection to spread. And lastly, the ear drops should be kept in a warm or room temperature. You don't want to keep it in a refrigerator saying that, oh, I've opened it, because you don't want it to be cold when you instill it next time, right? So keep it at room temperature or warm temperature. That's all. Have a good day.